Hey, everything's good. Doing good.
How the last time? How'd the crowds go the other day?
It went well. You know what I did? Instead of pulling in the crawdad hole, there's a parking lot on the other side of the kitty baseball park, and I just pulled in there and like walked almost up to the site, and some National Guard or airmen, they told me to stay back, and as long as I was right there. Yeah. And I got some the police action, through a lot of cars and waving people through. Pretty good. I thought about it, and as strict as they are about HIPAA, the license plates, and safety stuff, I'm going to say no right now. I've thought about doing it, though.
What's funny is like I was trying to get people to talk to me in line. Like half of the people that talked to me in that line were just going to the crowd at home. Hey, there's my taxi. And they're like, how much are you trying?
So did you get any one-on-one?
Yeah, but like I literally had to knock on a loophole. I had it in their window, and I was like walking as they were driving forward. Sometimes having to like kind of run up and pick them up in a perfect spot. Not an easy environment.
Hello. Oh, okay. Hold on.
Good afternoon, and a big thank you to all of you for coming out here today at 2:30 on Monday. It's a great occasion that we're celebrating. But as all of you know, we are here at Trustmark Park, where the Mississippi Department of Health, Mississippi Emergency Management Agency, and the Mississippi National Guard have had a site for vaccinations up and running for quite a few numbers of weeks, and are working and will be successful at administering thousands of vaccines to Mississippians today. We know that it took a long time and a lot of sacrifice from many of our fellow Mississippians to get to where we are now. Right now, Mississippi is one of the only states in the nation where any person above the age of 16 that wants to get a shot can get a shot. We've got a lot of work to do in the coming days and weeks, encouraging more and more of our fellow Mississippians of the importance of the vaccine and of the importance of getting inoculated. I plan to lead that effort, and I know that there will be many others across the state that will work hard in your local communities, convincing more and more of our fellow Mississippians of the efficacy of this vaccine. We said a little over 3 months ago when we started administering vaccines that we had caught our first glimpse of the light at the end of the tunnel. We acknowledged that at that time the light was dim, but it brought with it a hope of a return to more normal life. Today, that light is a little less dim, and it's getting a little bit brighter every single day. I'm extremely excited to announce that today, Mississippi will administer our 1 millionth shot. Approximately 365,000 Mississippians have been fully vaccinated, with approximately 650 to 700,000 Mississippians getting at least one shot thus far. So how did we get to this point? Let's wind the clocks back for approximately a year and 2 weeks. March the 11th of 2020 brought with it the first positive case of COVID-19 in Mississippi. I remember exactly where I was when I got the call from Dr. Dobbs confirming that. And I'm sure many of you, if you think about it, will remember exactly where you were when we first heard that we had a positive case. A few short weeks later, the entire nation experienced unprecedented actions to flatten the curve and to protect healthcare systems across America. For months and months and months, we have worked to fight this virus. To do that, each of us have had to make individual sacrifices. We spent time away from our loved ones. In fact, just this past weekend, I got the opportunity to see my grandmother for the first time in a year. She turns 90 on Thursday. We're both fully vaccinated now, and that was just a glimpse of getting back to normal for me personally. We've spent time away from our churches, and we've spent time away from the normalcy and the routine that we had all become accustomed. I know that making these sacrifices has not been easy for so many of you. In fact, it was hard. It was burdensome. It was isolating. We've had challenges from a mental health perspective, and will continue to do so. But throughout it all, Mississippians kept doing what Mississippians do. We stepped up, and we went to work, and we helped ourselves, and we helped our neighbors. Because of these sacrifices, and because of the amazing people in this state doing what needed to be done, including the men and women of the Department of Health, MEMA, and the Mississippi National Guard, and so many other state and local and federal partners, we are headed in the right direction to beat this virus. To be perfectly honest with you, this past year has made me even prouder to be a Mississippian. Through COVID, through floods, through tornadoes, through hurricanes, through ice storms, and more, you persevered. You kept your spirit, and you never stopped working to help your fellow Mississippians. To all of you who have made sacrifices to get us to this point, thank you. 1 million is an awful lot of doses. And this, as you look out here today with the cars in line, with the men and women making the sacrifice to get shots in arms, know that this is happening in 20 other sites around the state. Also know that shots are being administered at hundreds of other sites all around Mississippi. It's not that those individuals or the people that are here aren't having to do the rest of their job also. It's that they're stepping up to help their friends and their neighbors. I want to say to the healthcare workers who have been on the front lines fighting every single day from day one, thank you. To the teachers and the men and women in uniform, and to the public servants at our state institutions who have put in countless hours to keep their fellow Mississippians safe throughout this struggle, I want to say thank you. I also want everyone to know that while today marks a major milestone of 1 million shots, we're not yet out of this fight. In fact, we know that the next million shots are going to be harder to get than the last million. They're going to be harder to get because of vaccine hesitancy. We have vaccine hesitancy in our state just like we see all around the nation. I want you to know, many of you saw me. I've taken the vaccine. My family has taken the vaccine. Many great physicians and community leaders around the state have taken the vaccine. And so in the coming weeks and months, we're going to continue to urge our fellow Mississippians to do just that, to take the vaccine themselves. I think you'll see us talk about the details as to why we believe that this is the right course of action for all Mississippians. 3 weeks ago, when we had a briefing, many of you were there, our total number of cases on a 7-day moving average were just under 600. This morning, our 7-day moving average is just under 300 cases a day. But we also know that 300 is too many. And so we're going to continue to work to see that downward spiral in total number of cases, along with that downward spiral in hospitalizations, in Mississippians in ICU beds, continues to decline. And the best way for that to occur is for more and more and more of our fellow Mississippians to get in line, to roll up your sleeve, and to take the vaccine. With that, I'm going to turn it over to Dr. Dobbs and let him give you all a report.
Thank you very much, Governor. We're very excited to be getting over 1 million shots into Mississippians today. It's been a phenomenal effort with great partnerships. I can't speak enough to these National Guard men out here and women. They've done a phenomenal job working with our public health folks to set up really, I think, a model of the nation immunization process. If you look at the number of vaccines that have been distributed in Mississippi to date, the majority of doses have come through these type of sites, now located in 24 locations and growing. So really a powerful shout out to the success of these collaborations and to our everyday Mississippians. Today, Mississippi is reporting 95 cases and 0 deaths. That's a phenomenal number. Certainly want it to be lower, but we've come a long way. And why have we come so far? We've come so far for a few very simple reasons. We are here now because we've seen a phenomenal immunization effort, and we see that most of Mississippians over 65 and a growing percentage of Mississippians over 50 are vaccinated and protected. We know that they're much less likely to have severe disease and much, much less likely to go to the hospital or to die. So that's phenomenally important. But also, and I'm so very proud of my fellow Mississippians, that as we have added to our immunization stronghold of protection, we've continued to wear masks in public. Not because we have to, but because we know it's the right thing to do. So please, continue to do the simple things that we know prevent outbreaks. Wear a mask in public and avoid large indoor social gatherings. We know that it's much more safe to be outside, and certainly we've expanded access to sporting events outdoors, but still, for now, please follow common sense precautions. The last thing I'm going to ask is I want to ask all of our healthcare providers throughout the state of Mississippi to do their best getting vaccines to your patients. We know that last mile is going to be difficult, and we know that a lot of patients really want to get vaccines from their local doctors. So please, as soon as you get the vaccines, give them out as quickly as you can. And also, please, put them in the registry as quickly as possible. As we've transitioned more and more to providing vaccines to our partners, we've had increasing challenges accounting for those doses that have been given because they're not getting put in the registry quickly enough. We know there are many thousands of doses that are currently not in the system that have been given to Mississippians. So please, if you are a Mississippi provider, physician, clinic, make sure you get those doses in the system immediately, because that lets us know who's protected and how we're progressing in our fight against COVID. Thank you very much.
Thank you, Dr. Dobbs, for all of your efforts over the last year. One of the things I just want to reiterate, when we opened these mass vaccination sites, we knew that we had the capacity to do even more shots at these sites than we were actually originally doing. We intentionally made the decision to continue to partner with hospitals and clinics and pharmacists from around our state, because we know as we get further and further into the number of folks who have gotten the vaccine, it's going to become a little bit more difficult to get more shots in arms. And the best way in which to do that is to make it as simple as possible for our fellow Mississippians to get inoculated. That's the reason we continue to work to get hundreds of partners in every county throughout our state vaccines. And so it is critically important, however, as Dr. Dobbs mentioned, that our partners not only work to get those shots in arms, but also ensure that the data is collected such that our registry system is accurate. And I think you'll see more and more actions and effort from all of us to make sure that the numbers are accurate, because I will tell you, while we are celebrating the 1 millionth shot going into an arm today, what we're really celebrating is that we've actually have confirmation that our 1 millionth shot is going into an arm today. I would submit to you that we probably have approximately 10% greater than that in terms of total number of Mississippians that have been inoculated, because we know that there are a lot of different sources. And we made the decision early on that we definitely want to get shots in arms as quickly as possible, no matter what the consequences are. So we've got partners in the federal government that are doing things at the Veterans Affairs, Bureau of Veterans Affairs, Bureau of Indian Affairs. The Department of Defense is doing shots here, partnering with General Bowles and his team. So again, we're going to continue to work to get even better and more accurate data, but the more Mississippians that get vaccinated, the better. With that, I'm going to turn it over to Mac, who is going to give us an update from the emergency management team. Mac?
We marked the 1 millionth shot. There's some things that we need to look at on the Mississippi Emergency Management side. During this time last year, it was a wild, wild west looking for personal protection equipment. We were looking for stuff nationwide, and we were competing against every country, every state in the United States. But I'm proud to say that through the delivery model and logistics push that we had with the National Guard, the Department of Health, along with their purchasing, MEMA was able to purchase over 4 million N95 masks up to this point. 15 million gloves went out to first responders and medical staff. 2.1 million face shields. 2.3 million surgical masks, and 2.7 million worth of gloves. If you look at it, 18 million non-medical masks that were distributed to teachers, to students, to children, to those in the state of Mississippi who needed them at that time. We've traveled over 528,000 miles delivering personal protection equipment throughout the state of Mississippi. And that's to our hospitals, clinics, doctors' offices, and others that we're trying to treat those with COVID. I'm happy to say, Governor, that we have a 60 to 90-day supply right now in the logistical warehouse at MEMA, along with the National Guard who helps us manage that. It's been a great opportunity to have the state ready in case something else happens. So we're maintaining that stock. As we move into last week's weather events, we've got 7 confirmed tornadoes at this time. We're still looking with the National Weather Service at approximately 8 to 9 more to see where they're going to fall. We had 54 total homes affected, 7 businesses and 6 farms during that event. If we go back just a little bit further, there was an ice storm in the state of Mississippi. So we have about $22 million worth of public damage, about 1.9 million worth of residential damage, and $784,000 in commercial damage. We've completed 9 out of the 33 counties and the Mississippi Band of Choctaw Indians doing their damage assessments. We had to put that on pause last week while we were responding to severe weather in the state. And talking about severe weather in the state, coming up Wednesday and Thursday of this week, we're going to have another round, not as severe as last week, but it is something to pay attention to and for everybody to be ready. Governor, that's all I have for the Emergency Management Agency.
Thank you, Mac. Again, I want to also thank Mississippi Public Broadcasting, which has done a fantastic job working over the last year, ensuring that this information gets out to the people of our state, along with our media members that are here today and those that have been following this for many, many months and for a long time, daily press conferences. At this time, I'm going to ask General Boyle to come say a few words. I know that everywhere I travel, I get nothing but positive remarks about the way in which these mass vaccination sites are administered and the way they are worked, and it's a joint effort. But obviously the men and women of our Mississippi National Guard have done incredible work. I want to personally thank them, and I want to really let General Boyle say a few words, which really is the epitome of literally thousands and thousands and perhaps tens of thousands of federal, state, and local employees that have just done marvelous work throughout this pandemic. So, General Boyle.
Thank you, Governor. And I just want to say that as a military man, that we appreciate leadership with a vision, leadership with clear, concise directives, and we've had that with our governor. And Governor, I just want to thank you for providing that leadership for the National Guard during this time frame. You know, we've been doing this COVID operation now for about a year. We have enjoyed working with the health department and working out the complexities of what they have to tackle every day. MEMA has certainly been a partner in every exercise that we do domestically for the state of Mississippi. I'm looking forward to working with Mac more during this next year. I will tell you that while all this COVID has been going on, your National Guard has also been very busy providing our regular federal mission overseas, providing security for this great nation. We've just welcomed home about 200 soldiers from overseas that were providing air defense artillery support and MP support. We've also supported our federal domestic mission this past year during this COVID crisis. We've responded to 2 incidents up at the Capital Region, one for the inauguration, of course, and then we also provided support for protest in the Washington area last year, all while we were doing COVID support. I will finish by just saying this. When I interview these young men and women out here, I will tell you that while they enjoy doing their federal mission, both overseas and domestically, to the soldier and to the airman, they tell me that this is why we joined the National Guard. And that was to support our communities, to work with our communities, to do something for the people that we live next door to and for our communities. We consider it a privilege and a pleasure to be able to serve the state of Mississippi, and thank you for the opportunity, Governor, to do that.
Thank you, General Boyle, and to the thousands and thousands and thousands of men and women that you represent here today. With that, I'm going to turn it over to questions. We'll start over here with Scott.
Governor, I can't remember when we've had under 100 cases on a daily basis being reported. A lot of national media attention on spring break and what's happening over there, and what can be done to try to keep that coming back here and changing those numbers.
Well, there's no doubt that we saw upticks after Thanksgiving. We saw upticks after Christmas, and there is certainly the possibility that we'll see an uptick after spring break. But I'll also tell you the best way for anyone to not receive or contract COVID is if they're around people that don't have COVID. And when your numbers are as low as we find them today, that gives me reason for optimism that while we may see an uptick post-spring break, that hopefully it will be not in the same realm as what we saw immediately following those other two, Christmas and Thanksgiving. But it is an important thing to note. Today, we are not saying the COVID is over. What we're saying is that we've made great progress, and the way for it to become over, completely over and done with, is for us to continue to get vaccines in arms so that we get more and more and more of our fellow Mississippians protected. And we've got more and more vaccine supply coming online. The companies that have currently been approved are their manufacturing process has been upped, which is exactly what we have expected for literally a year, that once the vaccines were approved, then the private sector would see manufacturing increase. That has occurred. We also have seen Johnson & Johnson come online in the last month. We got an initial pretty big bump in the number of vaccines we got from J&J. Then we went 2 or 3 weeks with very small allocations. We do expect, starting as early as next week, but certainly the week after that, the 1st of April, seeing more J&J in our state. And now it appears that AstraZeneca is going to file for an emergency use authorization, which would be a 4th vaccine. But again, where we find ourselves today, we have literally, we'll see 20,000 or so at least shots in arms today. We'll see that each of the next few weeks. But we've got to continue to encourage people across the state that if you haven't gotten vaccinated, that now is the time to do it. There are appointments available at our mass vac sites. There are opportunities to get vaccinated in other locations around Mississippi. And we just want to encourage as many people as possible to find ways in which to do that. Cordia.
You talked about the light being a little less dim. Can you speak to when you will feel like we're on the other side of this? I know that there's maybe not a magic threshold, but a percentage where you'll feel more comfortable with where the state stands with vaccines, perhaps?
Well, I don't know that there's any one spot where I can say, okay, it's over. I certainly feel like now we have moved further and further and further back to a more normal scenario. What I will tell you is it feels a lot differently when you wake up in the morning and rather than seeing 1,444 Mississippians hospitalized as we did at our peak, when I get up and see 260. But the reality is 260 is too many. And we know from our statistics that if we currently have approximately 60 or 70 in ICU beds, some percentage of those are Mississippians that aren't going to make it. And so from our perspective, we believe that we've got to continue to drive the numbers down. We are at the lowest levels in total number of cases since May of last year. We're below 300 on a 7-day average, and that number is remarkable. Remember, we were at 2,400 and change at our peak, so we're literally down 85%. We are in a much better spot than where we were, and that's a good thing. But I don't want everyone to become completely complacent. There doesn't have to be a government mandate telling you have to do something for you to look at it and say, this is the right thing for me to do. If you're 65 years old and haven't been vaccinated and you're going to be going to the doctor and there are going to be 6 or 8 other people there, you probably ought to wear a mask, period. We know that that's certainly a precaution that is relatively painless that can be taken and should be taken certainly in the immediate future. But we have vaccinated as many as 135,000 Mississippians in any one week. That number is going to fluctuate. We knew that we were going to have a spring in which we had bad weather. A year ago, I never envisioned that we literally would be trying to move around and juggle schedules for mass vaccination sites around tornadoes that were hitting. We got in a situation last week where we had to cancel all of our mass vac sites on Wednesday, and so that kind of slowed down our total numbers last week. But again, we're going to have to do some of that this week with the bad weather. But the fact is that if you want a vaccine in Mississippi, you can get a vaccine. There are appointments available. Please, please, please protect yourself and protect your neighbors by getting one. Yes, ma'am.
This question's actually for Dr. Dobbs.
Okay.
Dr. Dobbs, the mask mandate was lifted about 3 weeks ago. I know the governor spoke to, we've seen a decrease in numbers in cases as well as hospitalization. You gave some recommendations for individuals that have been vaccinated and wearing masks and social distancing. Can you talk a little bit about what those recommendations are still with numbers dropping and more individuals getting vaccinated? Are those still the same things in place? Have they changed at all?
Yeah. So our public health recommendations are pretty much the same. Unless you're in a small group and everyone's vaccinated, you really ought to wear a mask. When you're out in public, you ought to wear a mask. You need to avoid large social gatherings, indoor social gatherings. That's still going to be the same. We recommend at the Department of Health that if you're over 65 or vulnerable, then you don't need to have any social gathering, go to church or any large thing like that until you get vaccinated. If we look at where our deaths are, almost all the deaths we have are in people who are 50 and older. And if we can get all of those folks vaccinated and protected, it's a different game. It's a different situation. So please get vaccinated. We're making progress every day. I'm super proud to walk around the state of Mississippi and people loving their neighbor by wearing a mask. It's fantastic. Yes, sir.
Is there certain days only where 16 and 17-year-olds can get registered for the shot? I had some calls that say that they were told by the people who were taking the calls they're only registering 16 and 17-year-olds on Monday or Tuesday.
No, there's only certain locations that have Pfizer, and we're switching most of the drive-thrus over to Pfizer anyway, so that's a growing number. And so right now you have to do it through the call line just to make sure that we send you to a location that has Pfizer, because that's the only one that's approved for kids 16 and 17. But it's not just Monday and Tuesday they're doing
they
it.
can register 16 and 17-year-old on Wednesday, Thursday,
You bet, yeah, absolutely. I'm not sure what that's about. Yeah.
Maybe for Dr. Dobbs or the governor, both of you, or especially the governor, you seem to allude to what we would see more of in the coming weeks about you all and the leaders of the state talking more about the whys of why it's important. Are you alluding to like a PSA campaign, or what should we be expecting, if you can say?
Well, I know that Dr. Dobbs and the State Department of Health have spent a little bit of time and effort and resources on educating the public. I think you'll see even more of that in the future. And you know, there's this great question out there as to given that there is hesitancy amongst some groups. You know, the natural is, well, who can we get to say go take it and they automatically take it? And the reality is it's just not that simple. The reality is we've got to all redouble our efforts at education and talking about the fact that the trials that took place for these vaccines, while they were expedited in time, they were still got approved in the same way through the CDC, the FDA. They were peer reviewed by scientists from other companies. And we've done 1 million vaccines here in Mississippi, and while there's been some minor challenges after particularly some of the second doses or even some of the first doses for those who have already had COVID, we're not seeing any large-scale major side effects. And I think as we progress on, I mean, we're basically in month 4. We're basically in month 4 of this process. And as more and more people that you know go through one of these drive-thrus or go through one of the sites, go to their local doctor, their local nurse practice, go to their local provider, FQHC, etc., hopefully more and more people will get it. But yeah, when we talk about what's coming, I wouldn't rule anything out. I try not to rule anything out throughout this entire year. But we are going to continue to look for ways to encourage and incentivize those to get it.
About this time last year, you mentioned the rainy day fund. Now lawmakers saying the economy is growing. What do you attribute to that?
Well, there's no doubt that in our state, because of the approach that we have taken in which we have focused on protecting lives while at the same time protecting livelihoods, that our economy is doing better on a relative basis than probably 45 other states around the country. I'm really proud of that fact. I'm proud of the fact that we have more people working today than we had in March of last year when COVID-19 hit. There aren't very many states that can say that. And because of that, we're seeing more economic activity. We're seeing people not only retain their jobs, but getting paid more in many instances to do either their current job or get new jobs. And because of that, our revenues at the state level continue to boom. We are approximately $500 million, $500 million, and that's on a $5.5 billion budget. We're $500 million above our revenue estimates for the first 8 months of this fiscal year. That's incredible. That speaks to the resiliency of Mississippians, and I'm proud of that fact. And I think that if you go around and talk to folks around the state, they're very proud of it as well.
Yes, Governor. Dr. Dobbs alluded to this as well, and talking about physicians reporting vaccinations across the state. You mentioned that there could be 10% more. Does that mean that there's 100,000 doses of vaccines that are unaccounted for? And if I was hoping you could explain that further. And Dr. Dobbs, could you talk about what could be the delay in that reporting that might be holding up this reporting numbers?
So the federal government has sent the vast majority of all doses to the states. But the federal government has also sent, and understandably so, has also sent doses to, for instance, Veterans Affairs. And so there are a lot of Mississippians, and I travel a lot and talk to many of our seniors that have gone to, they are veterans, and they've gone to the VA and they've gotten their shot. That's a good thing. That means we have more partners out distributing the vaccines. And so what we're working towards is to ensure that every time that occurs, that the system that we use for reporting through the CDC website is actually capturing that dose. And so the vaccines are not missing. It's just simply that we have more people inoculated than even we have accounted for. This is an issue in every state, and it's an issue that some have are working towards getting fixed, and I think ultimately we all will. Another example, I mentioned Veteran Affairs, the Department of Defense. The federal government gave DOD a specific allocation, and DOD is utilizing those allocations for active duty military, for instance. They're also using it for other areas. I mentioned Veterans Affairs earlier. Mississippi has a large number of veterans that would have been eligible to get their inoculation at their local VA. And so the point is there's a lot of different avenues to get your shots. More recently, in the Biden administration, they've made the decision to send more vaccines directly to the larger pharmacies, CVS, Walgreens, which again, we believe that the easier it is for people to get it, the better. But we got to make sure that there's a timely opportunity for us to get that information entered into our system. What you're seeing in our state, working with Dr. Dobbs and his team, we've made the decision to make a small weekly allocation to the Department of Corrections. The Department of Corrections is now beginning the process of inoculating inmates at the department. Again, in our effort to continue down that path, we've got to make sure that we are collecting that data for every single individual who receives it. In making that decision, it then, of course, begs the question, the Bureau of Prisons, the Federal Bureau of Prisons is getting an allocation, and hopefully they are inoculating in the federal prison system. We've got to make sure we're collecting that data. And so it's just a matter of data collection, and all of this is happening so quick, and we're getting literally tens of thousands of shots in arms every single day. We just got to take a step back and make sure that the data collection is entirely and completely accurate. Regardless, it's more important that those, whether it's 10,000 or 100,000 shots, what's most important is they're in arms and that those individuals are protected. But it's also important that we take that next step and that we we have a more accurate reading of total individuals that are protected. Dr. Dobbs and I talk a lot about this, but I think we both would say if we had 100% of those over the age of 50 fully protected or fully inoculated, the risk for hospitalization would be even less, of course, because over 90% of all hospitalizations in Mississippi, maybe 95%, have been in that category. Well, right now we have inoculated approximately 290,000 Mississippians over the age of 65 that we have verified. That's out of about 440,000 total. So we're about 2/3 of the way through all of those individuals over the age of 65. But the true number is probably a little bit greater than that, because many of our veterans that are going to the VA to get inoculated are also over the age of 65. So it's just a matter of data collection. Nobody's done anything wrong, or no one's done anything that they shouldn't have done, or not done something they should have. It's just a matter as we widen the number of partners, then we have to widen our approach to making sure that we touch those things. Yes, sir.
Going back to the state economy, and a question about Mississippi's share of the monies from the American Rescue Plan. Do you have to take that money from Mississippi, and do you intend to?
Yeah, I don't know that you have to take it. It's $1.8 billion. We are in the process of analyzing the federal bill. It was a huge bill that was passed very, very quickly. My team is analyzing that. The legislature is currently in session. We've been working very closely with them on a number of things. And so as we don't expect this money to actually be available for several weeks, and maybe even a month from now. And even when the money itself becomes available, the regulations that are being written by the various federal agencies could take months and months. So for instance, the new plan gives extreme discretion to the Treasury Secretary, and we are working to let our feelings be known with the current Secretary. This is true of my fellow governors and I. That's one of the things that we do regularly. In fact, I had a call this morning with fellow Southern governors, Republicans and Democrats, that have an interest in oil exploration and energy policy, and we met with a number of the current administration officials and recognize that we're not going to agree on everything from a policy standpoint, but we do have to communicate and make sure that we understand both sides of every issue. And so we're monitoring that, and we're looking and doing an analysis, and hopefully we'll have more information on that as the regulations are written by the various federal agencies.
Have there been any reports of any people trying to jump line and trying to get a vaccination without registering online through the process?
I don't know. I'm sure the answer is probably yes, but I don't. Not anything.
We had one of the shot locations when they ran out of shots because some people had come up and they got shots even though they weren't registered. I don't know if that's true.
I don't know if it's true, but if it is true, it's very it's not very common.
Yeah, now, we did have some issues about people running out of shots at non-Department of Health, non-National Guard drive-thrus. We're not the only drive-thrus in the state, and so whenever we've had opportunities to, we'll move vaccine around. I'm not sure that there's not a delay from time to time, but almost to a one, from what I've seen, is if someone shows up and they don't have an appointment, they will try to make them an appointment if they can and get them accounted for. But the instances that I've seen where people have run out of vaccines, it's at non-National Guard, Department of Health drive-thrus.
So I'll give you an example of what Dr. Dobbs just said. I just saw online earlier that in one of our cities south of here, they're doing a mass vaccination site at one of their community centers there in their city, and they have a maximum of 250 vaccinations each day. So it's great that they are opening that up. That makes it easier because I think it's over the weekend. It makes it easier for some people to get it. But it's pretty likely that if they're offering 250 Saturday and 250 Sunday, that they're probably at some point going to run out. I don't know if it's going to be at 10 a.m. or at 8 p.m., but at some point the first come first serve is going to eat up that. Yes.
Governor, the mayor of Jackson had made a comment in the New York Times that the state of Mississippi was not paying the city of Jackson for the water that is utilized at state office buildings, etc. Would you like to comment on that?
Either that was a complete lie, or he was informed wrong about what the state pays. My understanding is the state has spent well in excess of $500,000 on water alone, just in the Capitol complex. When the state of Mississippi is billed for water, like most people in the city of Jackson, by the way, when the billing actually works, the state does in fact pay for water in the city. And look, and that's one of the unfortunate things as we find ourselves in what we all agree is a crisis with Jackson's water system. There's enough challenges out there in which we all need to work together that nobody has to go out and lie to make it seem worse than it really is. We know that there are major challenges within the city of Jackson's water system. We also know that, for instance, the Mississippi Department of Health, through their loan program, has had a pending loan for the city of $8 million for the last year, and the city has drawn down less than 15% of that loan. If it was as simple as just getting the money and fixing the system, then they could have easily done that should they chose to do so. But a lot of times, I feel certain that the mayor didn't intentionally lie. I'm sure that he was just misinformed as to exactly what the state pays for in terms of the services that we use. Yes, sir.
Yes, Governor, lawmakers passed the teacher pay raise bill. Do you plan to sign that?
Yes. I said months and months ago that I would sign any teacher pay raise that was sent to me by the legislature. They did a good job recognizing the sacrifices that have been made by our teachers this year. We'll never pay them what they're worth. We know that because they do such tremendous work for our state. This is on average about a $1,050 pay raise, I believe. It's a good start.
Going back to last week, Mississippi was one of the first states to begin mass vaccinating prisoners. Can you talk a bit about what it took to get the ball rolling on that and why that was a priority that the state took on and got rolling quicker than most other states are?
Well, again, it's another area in which Mississippi is leading. I've personally felt very strongly that we should open vaccinations opportunities to all Mississippians before we started seeing mass inoculations within the Department of Corrections. But we were fortunate that several weeks ago we were able to do that because we are getting shots in arms, and we've got sites like this here that we see today where literally we're able to do tens of thousands of shots per day. We were able to carve a small portion of our overall allocation out and put them at the Department of Corrections. Another example of something that we're doing, again, we've got to get creative to get more shots in arms. It was easy early on in January because we had a lot more demand than we had supply. We've always said that at some point we're going to get to where there is as much, if not more, supply than there is demand. We're not there yet, but we're seeing the shift very, very quickly. So another example of something we're doing is offering shots for state employees in the Capitol complex at a time relatively soon, maybe sometime this week. I don't know exactly the date, but we're doing innovative things like that to make it where we can easily get shots in arms. Dr. Dobbs and his team are coordinating that and doing a marvelous job.
I know we just got to the 16 and older mark, but I've talked to some parents with children under the age of 16. Is there any word to them, any hope for them, for their kids?
Well, as Dr. Dobbs said earlier, there's only one of the 3 currently available vaccines that is available for those over the age of 16, and none of the 3 are currently available for those under the age of 16. My inclination is to believe that there are currently trials ongoing with kids, and as they get more data, it is likely to be found that some of these could be used, but we don't have the data in place. We don't have the approval from the relevant federal organizations. And quite frankly, the reason the trials were expedited for those adults is because what we have found is, and there are exceptions to this, but what we have found is there just aren't that many cases of individuals, even under the age of 50, much less under the age of 16, that have particularly bad outcome. There are exceptions to that, and we pray for those where there are, but there aren't a large number of them. And so, Dr. Dobbs, I don't know is there a time frame on the trials for kids or anything that you want to speak to?
Still working on it.
Yeah.
We'll keep a close eye on it.
Yeah, I don't think we have any definitive dates yet on that.
Dr. Dobbs, you referenced switching most of the vaccine sites over to Pfizer. Can you talk about if that's just a logistical issue or kind of the decision making on that?
Yeah, so it's mostly a logistical issue. Pfizer comes in a minimal allotment of 1,170 doses. And we're trying to get more doses out to small country doctors, that sort of thing. And obviously they can't take 1,170 doses. So what we're trying to do is we're trying to absorb those large orders through our drive-through sites, which is also good for the 16 and older kids. And then the Moderna and the Johnson & Johnson, which come in 100 dose allotments, we can ship those out to others. So it's really just trying to optimize the sort of complexity of the supply we're going to get.
The only thing I would add to that is in our weekly calls with the new administration, governors of both parties have encouraged the administration to encourage Pfizer to package their materials in smaller doses. But because of our approach, we're able to recognize that we have ways in which to distribute them and still get smaller packages of 100 doses or 200 doses out to our smaller clinics. Again, that was less of an issue 2 months ago. It's much more of an issue when we get into late April and May and June, because what we want, I know many of us have done this, we may go into our primary care physician's office for some other reason. Maybe it's because I don't know, I cut myself and I'll go in and get a stitch or two, and while I'm there they say, hey, while you're here you want to get your flu shot. We want to have it available so when people go in for a regular checkup or their wellness checkup or because something bad happened, hey, have you gotten your COVID shot? If not, let's do it. And so I think that's where we've got to head to, because we got to make simplicity an issue.
Yes, Governor, at sites like here in the metro area, vaccine appointments are still in really high demand, but we see a few thousand scattered across the state in various sites that might not have the same population density. What would be your message to the residents in that area on just how to view those numbers? Is it low demand, or is it just so much supply that it's hard to bring demand up to it?
It's a combination of a lot of things, and we're working through that. There's no doubt that if you look at the websites and the number of appointments that are available, for instance, there's a heck of a lot more available appointments at the Washington County site than there are at the Trustmark Park site. A big reason for that is because we have a lot more population density here, obviously. We've tried to distribute the vaccines based upon population to the extent possible. We've worked really hard to make the effort to ensure that we had an equitable distribution of the vaccines, and we'll continue to do that. But as we progress forward, if there's significantly higher demand in some areas, we'll have to have the conversation of how do we go from here. So far, we haven't moved vaccines significantly from one place to another, because while if for instance, when we opened things up to 16 and over last week, there was two ways to look at the number of appointments that were available. One of the reasons we were able to open it up is because there were appointments available, right? And there was about 10,000 appointments available when we opened it up a week ago. Well, if you can look at that as 10,000 appointments are available, oh my gosh, or you can look at it and recognize that we had about 35,000 appointments scheduled for last week and about 35,000 scheduled for this week and 35,000 more that were available for next week. And so you really had about 10,000 out of the 115 or so that were out there. And so less than 7 or 8% of the total number appointments were not yet scheduled. Now, as we progress forward, that's going to get a little bit bigger, and we're going to have to adjust. But the one thing that we've all learned over the last year is no matter what today looks like or what today brings, we're probably going to have to adjust one way or the other to deal with it. And the people behind me and the people they represent have done a fantastic job recognizing that. It looks like the last question. I want to again thank all of you for being here. Appreciate what you are doing. I also want to mention the Mississippi Highway Patrol. We have had members of the Department of Public Safety, the Mississippi Highway Patrol at virtually every one of our sites to ensure that we didn't run into any messes, and they, as usual, have done remarkable work, and I appreciate our men and women that are state troopers across Mississippi who have helped make that happen. So with that, again, thank you all for being here, and have a great day. Stay safe and God bless.